Hi everyone, I'm Uriarte. I'm a diplomat in veterinary neurology.
Hi, I'm Joao Loureiro. I'm an European specialist in veterinary cardiology.
And this is to vet or not to vet.
What is your question?
So the question is, how do you better yourself when you know what specialty you like, but you cannot do a residency?
Very good. Very good. So this is beyond what we were discussing when we said that if you start taking the role of being the person that does that specialty in your practice, you're going to develop. We now want to, when you've done that already, and you actually start going to the more detailed kind of level of knowledge. Is that what we're trying to do?
Yeah, exactly. You know that you like cardiology. You know you've read all the part of the Ettinger that talks about cardiorespiratory. You are doing a little bit of cardiac ultrasound. You're reading your own ECGs. But now what? How do you progress? How do you keep learning? What do you do?
I think there's two components to this. One is, for instance, courses, lectures, attend congresses that will be exposing you to that specialty. And the other one is, if you are going to be exposed to more cases of that specialty, you will start seeing the weird and wonderful cases and the more real world. And then you will need to start looking at papers. You will need to start looking at more detailed kind of information. There's nothing wrong with having a senior colleague that every once in a while you call for an advice. I think that's something that we do a lot. A specialist is give advice to people, but it is incredibly difficult. And that is a frustration that we feel as specialists, that if you're not there with them, for instance, in cardiology, a lot of the questions that I have is that, how do I interpret this image of this echocardiography? And the image isn't diagnostic, And so I can try as much as I want, but what we need to learn then is how do we better our acquisition of data, our acquisition of information. Yeah. And so for that, the courses are probably very important, and going to congresses and exposing yourself to that. And the other one would then be, so how do you look for the information that may be available for the patients that we are seeing? And I think in that respect, as we were saying before, search engines and the medical ones like PubMed, which such as the Medline network, so will be probably one of the best ways of doing it. But you need to know what you're looking for, don't you?
Yeah, exactly. I think that I realized that the ability to look on PubMed, it gets better the more you do it and the more you know. So probably I think that someone that is able to really get information out of PubMed is a very advanced clinician already. So I will probably say you start with your courses and your congresses where you are fed on diseases, on diagnosis, on papers, on nomenclature. And once you're a little bit more familiar, then you can, I think, start digging. I mean, it's a free searching engine. I think that everyone should try, and we should all, it's almost like learn how to code, to the language, you just need to kind of use it. And there are tips, and we have free content. We know that there are papers that they are for free. On the top right, you can choose if there's a review, if it's a free access. And then the tip that you were saying, always add between each word a plus. So then the search engine knows that you want all these words together in one paper.
The combination.
Exactly, the combination. Right. But you need to be a good clinician to be able to take information out of PubMed. It's much more targeted, and probably you and me, we only use that when we are looking for cases on our daily work, but you need a lot of experience. So what can you get from a course versus a congress? What would you say?
Let me just touch on the papers a little bit, because I think one of the things that's quite important when you start looking for papers is that you make sure that, for instance, the patient that you are researching for is represented in the publications. Because if you do a search on mitral valve disease, you're going to get hundreds. And if you are searching for that case that is a bit unusual, for instance, let's say with mitral valve disease, it's a large dog. And if you're going to look at a publication that basically did the population were Cavaliers, there may be a difference in survival. There may be a difference in the features of the disease itself. And so that is one of the things that I think it's important that you remember when you're searching for a publication. Your patient needs to be represented in that publication. Otherwise, you may end up getting different information. Now, I think I really like the courses. I really think that courses are something that you can, and I think a lot of times the delegates that come to my courses, I can tell that in the first day they're a bit shy and they don't bring their own cases because they don't want to show an ECG that is not a very good quality or an echo picture that doesn't look very good. And then hopefully by the second day, they start knowing me a little bit and you kind of go, bring your cases, let's discuss them, because it's really interesting to do that. So I think the other thing that you get from a course is a connection with a specialist. You know them, they know that you are interested, and you can start having conversations. Because we as specialists, we like to connect with our we see referrals, but with our colleagues that are interested in what we are doing, because we may end up seeing a very interesting case, or we may end up collaborating in a publication. So I think you will get what you will get from a lecture, what you'll get from a course. It's how I do things, and that's good and bad, because it is very biased. So you'll be learning just the way that I do things and how I deal with my cases, and that is obviously biased. And you know that the opinion of a specialist is worth very little, although we think it's worth a lot. A double-blind placebo-controlled trial is probably a lot more powerful scientifically, not probably, it is more powerful scientifically than the opinion of a specialist. But the opinion of a specialist is 10 years of just doing this, and therefore there's a place for it also. So I think you do get different things from a lecture, from a course, or from a publication. The publication, I suppose, is more scientific, if it is a good publication, but it may lack that savoir-faire, that kind of flexibility that you as a specialist will be able to discuss a case.
Yeah, no, and I think that what you said about the you go to a congress and that inspires you, that gives you like little twinkles of ideas, motivates you, starting a new procedure or starting to dig into a disease that you never heard about, or inspire you a case that you were completely lost, and then someone talk about something and you saw a video and you're like, oh my God, this is what probably I had. So it's just more an inspiration to keep going. Of course, I think I would like to touch a little bit on the course, because nowadays there's thousands of courses, particularly online. And obviously, I think that anyone that will be listening to what you're saying, everyone would love to go to a course where they can bring their own cases and discuss about their own cases, because I think that is what is missing and lacking a lot in the courses. So let's put out there what type of courses are available right now, and what are the courses. How could we advise for, how can you look for a good course? Because some of the courses online, they are so expensive. It's just like $2,000, and like it's a lot of money. And there is a lot of big companies. So how do you choose for a good course? What do you think that it could be important key factors for a course?
We have the other perspective, don't we? So a good course is a course that's given by me or a course that's given by you. So what is it? That's a tough one. That's a tough one, because it depends on your level, isn't it? So I at the moment do practical courses. So I teach people how to do echocardiographies. I do a little bit of emergency, and then I do lecturing in congresses, and they are completely different. You're absolutely right. And I think that the audience is completely different.
To me, I'm going to say this because probably you're not that exposed to these online things as much as I am. And I've been a lecturer at the university. I have created a neurology course for second year and for fourth year students. And it's very difficult to create a good course when you have 10,000 lecturers. It's impossible to have a continuity, because when you are working with people that they are in 6 different countries and you have 15 different specialists, each of them giving one lecture, there's no way that that course is going to have a cohesion.
That's right.
You're going to have lectures.
Yeah.
So it's going to be like going to a meeting. They're going to inspire you. You may hear things that they are interesting and they're going to make you to push and go forward. But if you want to learn in depth about a subject, it needs to be a course given by 1 or 2 people that they are talking to
and
each
small
other,
group
and
small group,
know,
don't you think? Yeah.
If you want an introduction, if you want to just kind of know, getting motivated, but there is absolutely no way that you're gonna get the same experience as a resident by doing one of these 1 full year neurology postgraduate courses that they are offering online. And I am being part of these courses and I'm giving my 2 or 3 lectures, but that is just let's start exploring what is out there and how I can start working in neurology. I think what you do your courses all yourself. So you do something that you just get to that very motivated group of people and you do the one-to-one. And that is really the courses that they are much more valuable, in my opinion. Not always easy to find, but they are to me more valuable.
So I think we'll say, if you want to be inspired, big congresses where you're going to get lectures and inspire you. If you want to start getting a little bit more into the details and maybe even expose yourself a little bit more, do these online courses or even kind of longer courses, like you said, for a year, where you're going to be exposed to different specialists. And then if you really want to get to the nitty-gritty on a detail of a surgery, like you were saying, of echocardiography, then you go for a small number teaching, where you're exposed to, hopefully you will be a very good lecturer and one that you will connect with, and then you're going to spend 2 days or 3 days doing something. I think that works really well.
And I think that is a good point. Like when you have these courses where you have 20, 25 different lectures, you actually get to know people. You know the people that they are good lecturers and the people that they are not good lecturers. And then if they are doing a little bit more in-depth course, you know that if you like them or not. Because as you said, the problem is that if you have one lecturer giving the whole course, if it's not a good one, then how do you know and how can you avoid that? But it is extremely, extremely, extremely difficult to teach whole neurology in a course.
Oh, it's impossible. It's impossible. It's impossible.
Yeah. So, and if you don't have, even being a director and being able in university to tell people more or less what you need to do, it is very difficult. So I will say that courses that, first of all, are done by people that they teach and people that they are also specialists. And remember, guys, that we don't want to be just a little bit posh. It's just that remember that if you have a diploma, you have gone through your supervised training years, you have sit an exam, you have passed an exam, you have spent all this time with your peers knowing about that subject. So it's more likely that you're going to have a better content on the course if the people delivering are diplomats from the European or American college. They may not be very good communicators, they may not be very good lecturers, but the content, you have a certain value that is going to be scientific content.
Certain assurance. And that's what a diploma, that's what a specialist is a certain, it's a certification of a certain level of quality of the work that you should be doing because you've been taught to do it to that level. Absolutely. Absolutely. Does it mean, like you say, does it mean that someone will be a very good communicator? maybe not actually. You may be amazing at doing a surgery, but actually not be very good at teaching. And that's where this exposure to these congresses, where you think, oh, I was really inspired by this lecturer. I really like the way that he talks or that she talks. And so if he or she is doing a course that will be 2 days or something a little bit more involved, then you move on. But it's very important. Yeah. But it's very important that you know where you are. There is absolutely no point coming and doing an echocardiography 2-day echocardiography course if you're at the early stages of cardiology, where you actually don't know what the diseases are. So that's why we were saying start with the big congresses and then go to something a bit more specific and then go into a small group teaching. And I think that will give you a progression into your learning that you'll enjoy and make the most out of, like you say, the big investment that it is, some of these courses, right?
No, I think that it is a good point. And I think that also, again, the certification that you said, people that they are teaching in universities, again, I've had very good teachers and very bad teachers, but that is part of their job. That's what they do. Be with the students, trying to simplify concepts, trying to communicate with the students, so that the people working in universities or that they are doing a lot of lectures, they're going to be a little bit more used to that. Someone that has just some kind of experience in their own way in their hospital, and they don't do this teaching and this kind of speaking with people. So we need to do a little bit of homework when we're going to be buying a product, the same way that we will do when we're buying a car. You're just going to do a little bit of homework, and nowadays
research,
and before you spend all that money. But I do like a lot what you said, the big Bibles. We said the clinical approach with starting to understand the diseases, the basic concepts. Go to these big meetings that they are the Southern European or the BSAVA, or these kind of big meetings where you have all the specialties. Usually you tend to have on these big meetings diplomats talking, that they are usually pretty good. They are big names, they are inspiring. And then you can then also know what is it to get a good lecture, because it's important that you know what you should get when you have a good lecture that inspires you, that you learn something. You will probably remember 5% of what they talk about, but it's a reality. It is a little bit of a difficult one.
And if you follow what we are saying, you'll also start like as a location. You will start, when you go to these meetings, you'll hear someone that is, if you're in Europe, you'll hear someone that's American, so it's somewhere on the other side of the world. And then if you start doing these things more online, you'll probably be someone that will be more local to you. And then if you end up doing a practical course or something, you will be someone that will probably be in your country or very close to your town. So you start kind of homing a little bit your knowledge into someone that will be exposed to the same cases that you are, because they are seeing the same population. So I think that hopefully will give you a nice progression of your learning. I think that's us.
But the other big problem is then language. But
True.
English is going to be, unfortunately,
always the same. Is the language of science. So until there will always be. And I think if you want to, that's a very good point, actually, Anne. If you want to get to a certain level in a specialty, you're probably going to have to invest a little bit in your English. You're absolutely right. Because you and I'm Portuguese, you're Spanish, and we probably had most of our conversations in English, because some of our conversations are scientific, and I can't even say most things in Portuguese that are to do with cardiology. I will say them in English. So I think that's a very good tip for us to finish on, is that invest a little bit on your English, read scientifically English, because that will help you understand and make the most out of all these lectures that we were discussing.
Yeah, exactly. Well, thank you so much for being there, guys. So this is to bet or not to bet.
What is your question?
Ask us everything you want. If you want to develop one of these subjects, it's lovely to speak with you, and we will see you soon. Bye-bye.
Take care. Bye-bye.